Hello, my name is Dr. Dewan S. Raja. Today I will discuss about a few multiple choice questions in dermatomes. Let's start. Multiple choice question number 1. A neurologist touched the lateral margin of the little toe of long-standing diabetes type 2 patient. Which of the following spinal cord segment is being most likely tested? A L3, B L4, C L5, D S1, E S2. Remember the lateral margin of the little toe. Okay, let's go to the second question. Okay, a dental student was testing the dermatome of face of a patient. The dental student touched the skin over the angle of the mandible. There is this part, skin over the angle of the mandible. Which of the following nerve carries pain, touch, and temperature sensations from the skin over the angle of the mandible? Ophthalmic nerve, maxillary nerve, mandibular nerve, facial nerve, great auricular nerve. Okay, you to pick up the right choice. Okay, then we'll go to the number 3. A 61-year-old man with a history of anti-cancer therapy has developed painful rash and blister along the left anterolateral chest wall, including the nipple. Which of the following left dorsal root ganglion is the epicenter of flare-up of herpes zoster in this patient? Okay, so the blister and rash is on the chest wall, including the nipple. So what should be the dermatome? T2, T3, T4, T5, T6. A 29-year-old patient has developed facial palsy in association with herpetic eruption that involve the ear, palate, pharynx, and neck. Which of the following ganglion is the epicenter of herpetic flare-up in this patient? Gasserian ganglion, geniculate ganglion, jugular ganglion, nodose ganglion, ciliary ganglion. What is the correct answer? Okay. Number 5, a 37-year-old AIDS patient, AIDS means acquired immune deficiency syndrome patient, has developed painful rash and blister on the right forehead, extending from the bridge of the nose to the vertex. What is the dermatome of this area? Ophthalmic nerve, facial nerve, maxillary nerve, mandibular nerve, greater auricular nerve. Okay, now we'll find out some of the matches. What is the dermatome of medial side of great toe? What is the dermatome of the thumb? Dermatome of little finger? Dermatome of tip of the xiphoid process? Dermatome of the umbilicus. Will match exact alphabet with the number. Okay, so then we'll get the answers here. Okay, so let's start from the very beginning. Okay, so we'll start from the very beginning. Okay, may not miss anything. Let's start. Number 1, lateral margin of the little toe of a long-standing diabetic patient. Lateral margin of the little toe, what would be the dermatome? Should be the S1. Okay. Then pain, touch, temperature sensation over the skin, from the skin over the angle of the mandible is the great auricular nerve. Okay. Root below is C2, C3. C3, C2. Okay. The great auricular nerve. Not this. Okay. And facial nerve, not the, even none of the trigeminal division. Answer is this. Not facial nerve. Okay. We got that. Question number 3. he is taking anti-cancer therapy. He is 16 year. The patient, he or she, is 61-year-old patient. So has developed painful rash along the anterolateral chest wall, including the nipple. The dermatome of the nipple is T4. Dermatome of the nipple. Okay. Then we'll go to the next question. A 29-year-old patient has developed facial palsy. So facial nerve has been involved. So there is paralysis due to the facial nerve involvement with herpetic lesion, and the ganglion in the facial nerve is the geniculate ganglion. Okay, that is involved. The site of flare up of the herpetic blister is from the geniculate ganglion. DNA was hiding there for many years. This patient has, like the previous patient, may have a history of chickenpox in the early life, in the adolescent period. Now in this situation, okay, so he might have that DNA present in the geniculate ganglion. It may erupt at his that may cause this problem. This is very rare condition, may happen in case of decreased immunity of the body due to any reason, maybe due to some type of chronic disease, maybe HIV infection. Okay, that may happen. Okay, 37-year-old AIDS patient has developed painful rash and blister in the right forehead, extending from the bridge of the nose to the vertex. What is the dermatome of this area? Bridge of the nose to the vertex area, dermatome should be the ophthalmic nerve. Okay, we got that. So previously we got, this is the geniculate ganglion here. That is a syndrome called Ramsay-Hunt syndrome. Ramsay-Hunt syndrome. Involvement of geniculate ganglion. The herpes zoster DNA was hiding there for many years. For any reason in this young man, that may happen usually in the older person, but it may happen in the young person provided he has some type of immunity problem. Okay, so that may cause the flare up of the herpes zoster from the geniculate ganglion. Okay, and here we got the ophthalmic nerve, that is the nerve for the forehead up to the vertex, including the bridge of the nose to the tip of the nose plus side of the nose and the upper eyelid. Okay, that is the ophthalmic division of trigeminal nerve. Now we will match some of the structure and the dermatome. Medial side of the great toe, what is the dermatome? It should be the L4. Thumb is C6, little finger C8, tip of Gifford pulses is the T, what is that? T6. Okay, umbilicus T10. Okay, and that's all about the dermatome. These are the answers. Okay, if you have any question, please feel free to ask me, and please share the information with your friends. Please support my channel and please subscribe me, and have a nice day. Bye now.